Our work today is really around thinking through how financial and contractual structures can better increase the flow of funds to dealing with social issues, both in terms of quantity and quality. Two examples spring to mind of where, despite the huge investment in health and social care, traditional NHS and private sector financial structures have struggled to meet some clear policy objectives. Peer support and carer models, which are much trumpeted and have been for many years now, where the Expert Patients Programme, a flagship programme for the NHS, still has an annual revenue of something like £7 million. The second piece is around integrated care. Despite the continual policy objectives and the continual effort across the system to better integrate care, time and time again we see fragmented and poorly coordinated systems. Our approach is to think about where innovative financial structures might help solve some of these problems. Social impact bonds are a way of raising investment for these preventative services. And at their heart are two contracts. One is a contract with the Public Sector Commissioner, in which it commits to pay for improved social outcomes. And the second is a contract with investors, where they agree to provide upfront funding for these services on the basis that if social outcomes improve, financial returns will flow. Social impact bonds are certainly not going to be a solution to all society's ills. They're really most appropriate where a range of conditions are met. For commissioners, there must be the ability to transfer the risk around some of these outcomes, and there must be a benefit for doing so. There must also be identifiable public sector benefits that are strongly linked to the measured outcome. There are also, with any outcomes contract, the standard suite of questions around whether one can accurately measure the impact that one's having and attribute it to the interventions. We need to see, for investors, a clear rationale for their involvement. They are at least as interested in the social impact of what they're doing as the financial return they're getting. The debate around spillover effects in public services and health more generally, I think, is in a sense a subset of some of the thinking we've done here. Spillover effects compel us to think more clearly about what outcomes commissioners are trying to achieve. We've got three broad avenues that a commissioner can take. They could just ignore the spillover effects and continue to commission as normal. We could see commissioners retain a focus on the service-based commissioning, broadening impacts which are considered in the commissioning process. It seems to me that the growing understanding of spillover benefits is one of the levers which is going to drive refocusing of commissioners on the outcomes that they're commissioning for. And what will give actually is the ways that they approach achieving these outcomes. This obviously means starting to think quite radically around commissioning and delivery structures, and begins to put a pressure on this silo commissioning model. This process, as we've seen in a lot of the fairly radical thinking that's gone on for commissioners around social impact bonds, is not without its challenges. It will imply a greater degree of information asymmetry for commissioners. It will imply an additional risk around implementation. It will make value for money difficult to think through, and will also push people up against funding restrictions. If we think about what benefits a social impact bond can provide some of these challenges, any structure where a commissioner can directly purchase outcomes can help cut through some of the issues around information asymmetry. Any structure where implementation risk is transferred away from the public sector can help commissioners in thinking more critically about about services they're commissioning and outcomes that they wish to provide. Commissioners can even go so far as to fix the price of desired outcome. Finally, one of the key benefits we've seen through thinking more critically about funding structures is to provide these flexible resources deployed outside of traditional budget headings and cycles. And this, I think, will be an exciting way for commissioners to cut through some of the funding restrictions that they'd encounter. The two key barriers we've encountered so far in developing some of these models are, firstly, a lack of data around what outcomes are achievable. The second avenue is in a sense more challenging. There are some distributions of costs and benefits associated with spillover benefits which actually hinder programme funding per se. Our approach is that thinking critically about rewarding outcomes and developing contract structures that explicitly reward such outcomes can offer a useful tool for increasing the funding to dealing with social issues and interventions that have clear spillover benefits, but also help commissioners think through more critically the outcomes that they're hoping to achieve, and more closely align the social value that's produced with the funding streams that are in evidence. The second area, as I've alighted on, is enhancing the measurement of impact and spillover effects. We can only do anything in the contracting and financial space where evidence is clearly laid out and impact is clearly evidenced. Commissioners and service providers are going to need information on achievable outcomes and appropriate price to function efficiently. And where the social investment market is growing and new sources of capital are coming available, investors in turn need the assurance that their products can deliver a social return. Standardising measures of impact will reduce these transactional costs, but will also give investors comfort that they are delivering something that is of value to society.